a little cameo by Garth. I felt like naming him Garth because of Wayne's World. Garth. I think his hair looks like Garth. Say hi, Garth. Yeah, good boy. He's going to be hanging out with us today. An amazing friend of ours, Tiffany. She takes great care of our pup dog there. We're going to be talking about breastfeeding and coronavirus, or breastfeeding and overall infectious diseases. Recent situations that I've noticed come about online with individuals and mothers, with children, in fact, even an infant that was infected, supposedly tested positive for coronavirus after having O2 deprivation or oxygen deprivation and apnea spells, and this was following a 2-month vaccination appointment. So it's a really unique situation, and I know that sometimes people get a little offended if you point out a specific situation in terms of somebody who shared their personal story on Facebook. And it was not directed towards me. It wasn't anything like that. It was through a friend of mine that brought it to my attention. So I'm not going to point that out specifically, bringing the name, the exact details of that discussion, but it was very concerning to me. And then seeing what are some of the recommendations going on right now in terms of news media articles and the fear that it's generating in mothers, I think this is a perfect time to go back through and go through the science that shows us that there is nothing that medicine can give you or your child. There's absolutely nothing that medicine can do for your child that your breast milk, that would be superior to what your breast milk does. So please, mothers, please stay tuned throughout this discussion. The advice to remove mother from baby during baby's infection or mother's infection is a situation that I personally completely disagree with. Trust me, there's only one way that my baby would be separated from my wife, from her mother, and that is when they pry them from my cold, dead hands. That's the only way it would ever happen. So that being said, that's where I stand on it. And you'll see why, and I hope that you can understand why it is literally, I would view that as a life or death situation if somebody is to say that my child who may be sick or be placed in an environment where they may become infected with whether it be coronavirus, influenza, or any of the superbugs that hospitals, in essence, that environment of the hospital creates. So the hospital is one of the best places to become infected. So the advice, even if a mother was infected with coronavirus, I believe would be really bad advice to say, let's remove the child from the presence of the mother, from that mother's arms, direct contact with the mother, and place them in a separate region of the hospital, an area of the hospital, which would still place the child at greater risk of infectious disease, whether it be hospital-acquired infections or others. And the research actually points that out, that the separation of mother and child, and this would occur even if your child is being taken when no one in the family, mother or child, is infected with anything at all, or that they know of, that nosocomial, hospital-acquired infections will increase anytime skin-to-skin contact, direct contact with the mother is discontinued or temporarily discontinued. And that is within the body of evidence and research that we have available to us all. So I'm going to point out and critique a little bit of this article here. Heartbreaking. Moms could be separated from their newborns under coronavirus guidelines. Here's the reality, though. I want to be thankful for the reality of this Johns Hopkins physician. Even though they recommend the separation, she does go on to, in the end of the article, note that the final decision is up to the mother. Thank you, Lord Jesus, that they would even let people know that they have that opportunity and option. Because a lot of times mothers and fathers are given a recommendation, and they're given that recommendation, whether it be a drug or a separation or anything like that, they're given that recommendation, and the parents have the assumption that that recommendation is like law. It's like there is no way around it. You have no choice in this. This is what you have to do or will force you to do it. That's coercion, and that is illegal. Anytime your physician does that, okay, you have to say at the very moment your child's life, unless they intervene, is at an immediate threat to their life, all right? And that would be an emergency situation. And an infectious disease, whether in the mother or the child, is not that situation. In fact, anytime they would separate the mother and the child, the evidence points, the scientific evidence all points towards an increased risk to that child, all right? And we'll be going through that in a moment. The article here, they say that there's possible separation of up to a week or more. They said that facilities should consider temporarily separating mothers who are confirmed cases or suspected cases until they are no longer thought to be transmissible. It says here, this is one of the biggest points that I will point out here, is this statement right here. It is not known if pregnant women are more likely to get sick from the virus, and why I highlighted and underlined this sentence here. In essence, it is not known what, if any, risk infants face if their mom has coronavirus 19. So that is the statement in the article. And this is coming from supposed medical experts. They state they don't know of any risks. The risks are not known to the infant. But their decision without evidence of risk is to ignore all the evidence that shows benefit. So when they go further on in this article to say it comes down to assessment of risk versus benefits, Gene Schiefeld, professor and director of obstetrics and maternal fetal medicine at Johns Hopkins. Right now, we have come down to that the risk of skin-to-skin breastfeeding COVID-positive moms is high. They come down to say it, but they say they don't know. They don't know the risk posed to the infant if mom is infected. So why not use all the other evidence we have out there that I'll show you in a minute that proves that the separation of mother and child, whether mom is infected or child is infected, that anytime that is done, you increase the rate of hospitalization and serious respiratory infections, gastrointestinal infections in the infant. You increase the rate of hospital-acquired infections in the infant anytime you stop skin-to-skin contact. Because then their bodies, once they are born, their bodies are being colonized by the microbiota, by the environmental either pathogens or beneficial bacteria that are in the environment around them. And hospitals and babies born in a hospital, when they are not breastfed, when they are not vaginally born, when they are separated from mothers, when the mother is given an antibiotic, every time those measures taken by a hospital to supposedly protect the child have been documented to increase the odds of chronic and acute infectious diseases and chronic severe disabling and lifelong health problems. So the evidence is extremely clear that skin-to-skin contact and mother having contact constantly and even exclusive breastfeeding protects the infant even when the mother is infected, and that's with influenza-related research and evidence. It would be heartbreaking, one mother says, and this is the thing, is advocates for breastfeeding are arguing against this recommendation, and I am too. It would be heartbreaking, she said, if you're establishing your schedule in those first couple of weeks and bonding with the baby. So I can't imagine that aspect being taken away. And I highlighted that specifically as I went through this. And this comes from, I believe, Jessica Powell. Nope, not Jessica Powell. Preschool principal, Hayward, Virginia. Trying to think of who this statement is coming from. But I did link TWD in the comments, and you get the links to the articles and things. So you'll be able to confirm who that statement was coming from. But it was an advocate for breastfeeding. Yeah, sorry, I can't find the name real quick here. But it's not going to, and it can't be taken away unless you allow it. have no legal right to remove your baby from your presence if you're infected or not. And I believe this information that I'm about to go through with you will bring about understanding in a different perspective than this fear-based perspective of anytime somebody's infected, separate everybody. Again, one of the main reasons I am doing this is because I saw that a mother and father left their child at the hospital after the recommendations by the medical physicians in that hospital was that their baby was infected and the mother and father were to go home and separate themselves from that child. Unacceptable advice right there. Extremely dangerous and harmful advice right there. And you'll see why I say that. But multiple articles online have been posted. I do say, well, this may lead to healthier generations in the future because coronavirus concerns are actually spurring on the desire of many mothers to consider home birth. Interim considerations for infectious prevention control of coronavirus in inpatient obstetric healthcare settings. To reduce the risk of transmission of the virus that causes COVID-19 from the mother to the newborn, facilities should consider temporarily separating separate rooms the mother who has confirmed COVID-19 or the PUI or possible infection or exposure from her baby until the mother's transmission and precautions. Okay, consider using engineering tools like physical barriers, curtains between the mother and the newborn if another room is not available. Keep the baby 6 feet from the mother. During temporary separation, mothers who intend to breastfeed, and this is one of the most upsetting things, mothers who intend, they don't talk about how important it is and how beneficial it is. And my heart breaks for the mothers who may have not had the health status to be capable of breastfeeding their child or had the suffering and the pain and the situations that come about and make it difficult to breastfeed an infant. My heart breaks for those situations for the mothers, but why didn't they talk about how amazing the mother's milk is for prevention of respiratory infections in these children when they simply say, mothers who intend to breastfeed, yeah, go ahead and pump and have somebody else provide that milk to your babies. But they never once on the CDC's website talk about the science behind how effective it is for breast milk, breastfeeding, direct contact with the baby. They never once talk about how effective it is and how the body was designed, how the connection between mother and baby is so detailed in its design by God that the baby's saliva can transmit signals to the mother through her breast milk. So mothers, you are in essence, your breast is receiving information. You are literally feeding on that baby's saliva. The baby is feeding on you while your breast is actually absorbing those cytokines and other immunomolecules that transmit signals and communicate with your body and your immune system to say, hey, baby is infected. Mother may not be infected, but baby can actually signal through their saliva, through the mother's breast, only through direct contact. See how critical this is? Only through direct contact with the mother's breast can baby signal to mother that baby is infected with something. And then mother's body responds. Mom's amazing milk changes so as to provide immune cells and cytokines and signaling molecules, all these things that are necessary for baby to remove and fight off that infection. But their advice to do such things would put babies at risk. Breastfeeding protects against infections in Indian infants. This study all the way back in 1979 makes a huge statement. The protective effect, which lasts even after breastfeeding was discontinued, was independent of family size, overcrowding, and other social economic statuses. Gastroenteritis occurs in only one breastfed infant. Breastfeeding was strongly protective against severe infection requiring hospital admission and also against minor infection. about a year ago, I did another one because at one point in time, the CDC had actually recommended that mothers be separated from their infants if they came down with influenza. This is a snapshot that I did from the CDC's own website that they since changed. They changed from the time I did the video till the time, and we posted it online, so I did an update. And here's their updated version. And I'll even go to what they said here. And this is an example of information we have and evidence we have of best practices during infectious illness, whether in the mother or the baby. Can infants who have flu continue to breastfeed? Yes. When an infant has the flu, a mother should be encouraged to continue breastfeeding, express breast milk to her infants. Infants who are ill need fluids to stay hydrated and everything else. They don't go into detail. Should mothers continue breastfeeding if they have the flu or come in contact with someone with the flu? Yes. A mother's breast milk contains antibodies and immunological factors that can help protect the infant from the flu and is a recommended source of nutrition for the infant even while the mother is ill. They say, though, the only time if the mother is too sick to feed directly, then assistance of breast pump or other means in a caregiver to take care of baby, hold baby, and feed by bottle, but mama's breast milk should be the primary source of nutrition, or the only source of nutrition, in my opinion, if you look at the evidence that shows exclusive breastfeeding up to 6 months has superior benefits over breastfeeding exclusively to 4 months and then partial to 6 months. But exclusive breastfeeding all the way to 6 months showed the maximum amount of benefit to our infants, to our children. So we need to encourage that. I'll skip that statement as it pertains to more antiviral medications and those things. Maybe I won't skip it actually, because I think this would be pertinent to this situation as well. They talk about, are antiviral prescription medications safe for use in mothers in breastfeeding and providing express breast milk to their infants? They say yes, but the data on the effect of these medications on breastfeeding are limited. So basically, they don't have data to say yes, but they say yes. They cite no research and evidence of benefit in safety. We'll talk simply about here shortly about kangaroo carrying, basically holding your infants, being against your body, being with you. The effects of daily kangaroo care on cardiorespiratory parameters in preterm infants. See, what would happen most likely, unless you have a family member to be there and hold your baby consistently. And this is why this type of information is actually being applied, thank God, in situations where babies, are being born addicted to opioid prescription medications or being dependent chemically on those drugs. Not necessarily addicted, because the baby, and when we consider addiction, we consider it more of a partial choice. Partial, I say that specifically, because there is a massive chemical dependence that many people are suffering with. But babies who are held, they literally, for the number of babies being cared for in hospitals, the results of survival and pain and anguish and crying and all these outcomes that babies express in terms of their fear, in terms of their panic, in terms of their mental health, all these things, that just holding a baby significantly improves outcomes in those babies that are born to mothers that used opioids during pregnancy. Well, application here is the parameters of preterm infants. Cardiorespiratory. Respiratory. Kangaroo carrying reduces bradycardia and oxygen desaturation events in preterm infants, providing physiological stability. Listen, that physiological stability is crucial to an infant's life and health and survival. Oxygen desaturation events would increase just by not holding and carrying a baby as often. That is huge, especially when we're talking about infectious illness that causes pneumonia, ultimately leading to oxygen deprivation. Another study in pediatrics, 2010, prolonged and exclusive breastfeeding reduces the risk of infectious diseases in infancy. Right there you have evidence where again, in the article in the CDC's recommendations, they admit they have no evidence that there is risk when a mother is infected with COVID-19. They have no evidence of risk to their baby, but they have massive evidence of benefit in reductions in infectious disease as well as mortality if baby is breastfed exclusively. Exclusive breastfeeding to 6 months tended to be more protective than exclusive breastfeeding until 4 months and partially thereafter. Our findings support health policy strategies that promote exclusive breastfeeding for 6 months in industrialized countries. Healthy birth practices number 6, keep mother and baby together. It's best for mother and it's best for baby. In 2014 study, an article, immediate skin-to-skin care enables colonization of the newborn to maternal flora versus hospital flora. So take the situation where a mother's already been confirmed to have coronavirus or an infectious illness of respiratory nature especially. Take that situation where she is given bad information off of no known risk to her infant. Again, I'm stating what they're saying. Johns Hopkins, CDC, say they have no known established risk. And they immediately say, when that baby is born, we're immediately going to rush that baby into another room of the hospital, keep them away from mother. Thus, the microflora that is protective against infectious diseases, type 1 diabetes, and a list of whole host of other chronic and acute illnesses, they would begin colonizing that baby with hospital-acquired, often pathogenic bacteria or viruses that would pose significant established scientific risk to that child. So do you see why their perspective of fear is going to harm children if people aren't given the truth? To protect against infections and promote breastfeeding. Interrupting skin to skin. This is what would happen if mother or baby in the situation, especially in infants, they are placing babies' lives at risk. Again, I only have one account that I have seen online and been told about where a mother and father left their child at the hospital because of the advice of medical physicians at that facility when they said that infant had coronavirus. Now, they may be transporting milk from the mother back to the hospital. I don't know. Sadly, I would probably lean towards it's probably not what's happening. But that mother's milk in that direct contact with a child who has a virus, that infant needs your mother's milk. She or he needs your milk. Please, I beg, do not leave your children in the hands of the medical community. They have no treatments. They have no effective strategies that they're willing to implement. And there is no herb on this planet that would do better than your milk. Mothers, please hear my plea. Interrupting skin-to-skin care for early bathing. Early bathing increases the risk of neonatal hypothermia, removes maternal bacteria and vernix, which increases the risk of infection. Cleaning your child in a hospital increases the risk of them coming down with a hospital-acquired infection. But they still do it because they don't care about the science. Most of them don't, at least. Because they can charge you for baby's first bath. That's my opinion. Children who are not optimally breastfed are at higher risk for short and long-term illnesses, diseases such as diarrhea, respiratory illnesses, lower respiratory infections, sudden infant death syndrome, suddenly dying, type 1 and type 2 diabetes, obesity, elevated cholesterol, pneumonia, and leukemia. Those are all associated with lower rates of breastfeeding. Not just non-breastfeeding, but lower rates of breastfeeding, less breast milk. All of those issues. Breastfeeding is associated with the production of type 1 interferon in infants infected with influenza virus. So when an infant is infected especially, their body tries to respond, but mother's milk, these observations suggest that breast milk can protect against respiratory viruses. Coronavirus is a respiratory virus. Why not use the evidence we already have available to us? They're not using their own science, sadly. But interferons interfere with, and listen to this. So this is what mother's milk would do. Some of the most important inflammatory mediators synthesized and released in response to infection agents include the antiviral interferons, interferon 1 being that. Essentials of immunology. Did Johns Hopkins researchers and scientists and doctors, did the CDC forget to read the essentials of immunology? I'm using their own medical textbooks. And the science shows that breast milk is what provides and enhances the ability for that baby's immune system to interfere with the infections, with viral infections. I'm sorry, but their advice is incongruent with the science that is available. And again, they even admitted to it. They said, we don't know risks. So how are you weighing risk versus benefit and saying, we feel it would be better to remove baby given the evidence we have of no known risk? So you have nothing on this side of the scale of risk. You have nothing except for your fear-based opinion that you're scared to death of the common cold virus. That you somehow say suddenly mutated and now no one's immune. No one can fight it off. It's the deadliest virus in the world now. All of a sudden we've got to quarantine the entire earth and remove babies from their mothers because we're afraid, but we can't establish any scientific basis for our decision of saying that there's heavier weight on risk than the benefit of mother being present and their baby in their arms breastfeeding, when the science is extremely clear that breast milk, exclusive breastfeeding, contact with the nipple improves and protects the outcomes, protects babies in terms of viral infections. Maternal and infant infections stimulate a rapid leukocyte response in breast milk. Breastfeeding protects against infection in Indian infants. Already read through that one. Immune cell mediated protection of mammary gland and infants during breastfeeding. At birth, the infant's immune system is still immature, they say. It's not immature, it's designed that way. See, immune activation and immune responses generated by the baby, such as those caused by vaccinations and other medical interventions or illness, can result in alterations in the brain, in brain development. This is proven through animal studies and shown in human trials and observational trials that hepatitis B vaccination can alter the brain and cognitive function of infants in the future, and confirmed on animal studies that it changes the structure of the brain. Thus, here is what God designed. He designed mother's milk to be, in essence, the child's immune system during early infant stages while the brain is developing, to protect baby against harm, both infection in nature as well as neurological in nature. But medicine intervenes and thinks they're greater than God, thinks they can be God, wants to say that God made mistakes, or want to say that God doesn't even exist. The Godfather of Vaccinations, Stanley Plotkin, has literally gone on video in conferences training medical physicians and supposed scientists from around the world, saying that his Bible on vaccines is more accurate than the Bible itself. He's even gone on to say that God wishes death, disease, and destruction on people, and it's him and vaccines that are in essence the savior to humanity. Insane. Insane. These maternal factors protect the infant from infections and assist in the development of the infant's intestinal mucosa and microflora, gut bacteria, and its own defenses. Breastfed infants have a lower risk of necrotizing enterocolitis and reduced susceptibility to gastrointestinal, respiratory, and other infections than formula-fed infants. See, the problem is in the situation where moms are told, you're infected, you need to be separated from your infant. Guess what many mothers and most likely many medical physicians who don't understand the science are going to think? They're going to think this viral infection, which if you go back to the science we have available to us in terms of other respiratory virus infections such as influenza, you would know that virus infections cannot be transmitted through the breast milk. So God, please allow every single mother to know that information so that their medical physician, who may be unknowing, tells them, we shouldn't give your child breast milk right now because if we do, you might infect your infant. And if they do that, they are placing the child at increased risk. They would be formula feeding the baby, and by that advice, they would increase their risk to that child. These benefits result in substantial reduction in infant and child mortality death rate by being breastfed, particularly in the developing world. Function of breast milk leukocytes for the infant. Arguably, breastfeeding is the optimal and most effective avenue of immunological protection of the infant. That's the science, folks. Although the maternal breast response to infant infection is not fully understood, we have proposed that the retrograde ductal flow, retrograde back into the body, flow associated with the milk ejection during breastfeeding is a route of the transfer of pathogens from the infant's oral cavity or signaling molecules, in my opinion, is what it would come down to. Oral cavity to the mother's breast via the nipple, which may locally stimulate an immune response in the breast, which would then result in increased immunological factors transferred and fed to the baby. But how does that work? It only occurs in contact, not a pump. Contact is needed. The worst situation that I could imagine, and I pray doesn't happen, but will almost certainly happen because of the advice and the poor teaching. Doctors were supposed to be teachers originally. Are you going for the advice of somebody that simply Googles what prescription to give you or relies on some other scientific lab to just do a lab test and then say, here's your results, and this is the drug we give? If you're not going to someone who teaches you about how your body is so wonderfully and beautifully made, how your body actually functions, how the connection between you and your baby actually happens, and how your body provides the immunological immune factors that are necessary to protect baby, not only under short-term but long-term chronic illness risks. If they're not teaching you something like that, you're not going to a doctor. You're going to a drug dealer. That's the difference. What happens? Healthy baby, healthy mom, neither infection. And you're not unhealthy when you have an infection. Let me make that very clear. I always, mothers or fathers call me up and say, hey, my child's got the cold or the flu. And they say, we're sick right now. I always correct them and I say, you don't have a sick child. You have a healthy child who's fighting off an illness, who's fighting off an infection, in fact. They're not sick. There are powers in your word. There's power in your words. There's power in the tongue. Speak life over your children. Speak life over yourself. Speak power into your own spirit and body. Believe in yourself. Believe in the design God gave you. Because this is God's design. When an infection is occurring either in mother or baby, that's what happens. That's immune. There is nothing in modern pharmacia or pharmacies or medical physicians or in the hospital that can do as much as one single bag of mother's milk can do for your infant in its ability to protect and prevent both acute and chronic illnesses. You're a healthy individual if you're doing the right things. You're taking care of the right puzzle pieces that build your natural immune system and give your body the capability of responding when necessary to an infectious disease, virus, or other. So ladies, just like my wife, you're all beautifully and wonderfully made by God. Do what God designed you to do at all times, in all circumstances. Whether you or your baby is infected, God designed you to be there to provide protection and an immune system for your infant. Please know that. Be equipped with the science now. Please share the truth. Don't just like it. It's the only way we save lives. I'm going to go to some questions here on Facebook real quick. And I want to give a shout out to Jenny Pfeifferone Photography for doing this amazing photos of breastfeeding for our family. So, I'll probably get flagged on Facebook for a baby's rear end.
I doubt it.
Okay, good. Mary Beth, so true. I have witnessed that myself. Mary Beth says, thoughts are frequencies. Okay, Jean, oh, good quip. If you're medical professionals, a doctor or drug dealer, experience of breastfeeding mothers are necessary. I did when I had a cold and flu and my daughter didn't get it despite me sneezing everywhere. That's one mother's testimony. Does that mean HIV positive moms can safely breastfeed? There is evidence in those articles of interferons, immunological factors that actually can prevent infants from becoming infected with HIV if breastfed. But the science, I have not dove in depth in that specific viral infection. But again, personally, I would want to lean towards I would probably want my wife to breastfeed. All right? Because there are interferon factors and immunological factors that prevent infection. It's well established with hepatitis infections, another blood-borne infection, or bodily fluid infection transmission type viral infection, that these hepatitises can be prevented in infants if they are breastfed. So I haven't read up on HIV, but I'd have to do that to be able to give a statement on that. Diane, can you please list these studies, especially with coronavirus and hepatitis B for babies? So interesting. The studies that I've gone through today will be on the website, TWD, in the comments on Facebook. You get access to all the articles and studies that are referenced in this presentation. It does not work on YouTube. You can't comment TWD on YouTube and get those. You just have to go in the description of the video on YouTube, and there's a link there that will be provided to shoot you over to the website, thewilddoc.com, and then you can get all the references with this video. The lack of contact of the infant to the mother is not good for the quality of milk. When the contact of fluid in the infant's mouth to the breast, absolutely. Thank you, Jean, for chiming in there. I'm a NICU nurse, Diane says. We now wait 24 hours for a normal newborn bath. 24 hours, I would never bathe my child never in a hospital. honestly. And I understand, Diane, you're probably chiming in there to say that they are postponing that to allow for the vernix to oftentimes be absorbed through the baby's skin to give that protective layer, to allow the skin-to-skin contact. But I would never wash clean with antimicrobial soaps my child that has been skin-to-skin, allow the vernix to absorb in, and then wash away what mother gave to baby, therefore transporting baby through the hospital, allowing for a recolonization of hospital-acquired type bacterial strains or viruses. I just would not personally do that. I breastfed my four kids. Anytime I was sick, breast milk miraculously generates the antibodies needed to the baby. When mom is sick, moms need to continue to practice frequent hand washing and pre-feeding. I would agree. The hand washing and cleanliness is a good thing to practice. Yes, why not give the baby the right mother for the mother's care, the right to the mother. Seems like a real no-brainer. All right, I'll go to the end here. Liquid Gold, Jackie. I am breastfeeding my youngest while watching this. Awesome, Jackie Moore, awesome. Maria, what's next? Mamas can't be near their own kids. Where does the insanity end? I agree with you. The insanity ends when mothers are equipped with the science and common sense that it seems the CDC and other medical professions are lacking. They ignore the science and use their own internal fear and opinions that lack scientific justification to make calls and recommendations to put babies at risk. That's what's happening right now. All right. So I hope you're all equipped with this information. TWD in the comments on Facebook alone, YouTube, search in the description, and you'll get the link to the website to be able to go and acquire all the scientific studies and articles that I went through in this video. I want to equip you with information. I want to equip you with knowledge. Don't just take my word for it. Go and study this stuff. Learn this stuff. So that in the event you need to stand your own ground when being given unscientific and non-common sense recommendations in a situation such as what they're talking about, what we're discussing here today, you'll be able to stand your ground, mom and dad, to be able to say, you're not separating me and my child. You need to go back and read the immunological textbooks you were supposed to in school, and go back and read the research that's available to you and I just from a quick PubMed search. Keep your baby close to you at all times, please. Please, please, please. Even the risk of PTSD, psychological issues, depression are increased when babies are separated from their mothers, when they aren't held by their mothers and fathers. Please be there for your babies at all times. All right, everybody, I love you. I appreciate you. Please share the truth. Don't just like it. That's the only way we save lives.